Hi there. My name is Eric Peterson, and I'm on the board of the Sarah M. Peterson Foundation. In a decade of working to prevent suicide, I have learned a couple of fundamental things. One is that suicide is absolutely preventable. Suicide happens when a person who is hopeless and in extreme pain connects with lethal means. If we break that connection by identifying people at that extreme point and keep them away from lethal means, we keep them alive to get the help they need. The other thing I have learned is that education and training are vital components to ending suicide. Like so many other survivors of suicide loss, I have become educated and trained in suicide prevention after surviving a loss. In my case, it was the loss of my daughter, Sarah. And like so many other survivors going through these trainings after a loss, I learned about signs and symptoms that, in retrospect, were there. And had I been trained to recognize them, things may have turned out differently. It is a hard truth to live with. Decades of research have taught us that people who are thinking of suicide always display at least some of the behaviors taught in suicide prevention training. The dots are always there. We just need the knowledge to recognize and connect them. Suicide prevention training also gives us the tools and confidence to step up and step in to break the chain that can lead to suicide. With that in mind, the SMP Foundation is using the power of knowledge to build a community-wide safety net that will catch our family members, friends, and neighbors before they become another suicide statistic. There is much work to do to achieve our vision of a world without suicide. Research to understand brain illness and develop more and better treatments to bring people back to health, advocacy to ensure there are no barriers to healing for those suffering from mental illness, and education and training to ensure every community has enough alert and capable people who can identify someone in crisis and ensure they get the care they need to stay alive. The SMP Foundation is focused in on that third piece, using the power of knowledge to build a community-wide safety net. This is not a new idea. We have already done this in the U.S. with cardiac care. Back in the 1950s, there is a good chance that if someone collapsed in a crowded public place having a heart attack, most bystanders would have had no inkling of what to do to try to save that person's life. Today, that is unimaginable. Today, we would see people immediately respond with knowledge of CPR. Someone would be headed to find an AED, and someone would be calling 911 to get trained professionals on the way. We need to get to that place when it comes to a suicide crisis. Right now, we are in the bystanders not knowing what to do place. And in too many cases, we are in the bystanders not sure what they are seeing place. But you can help move us forward. There is something you can do today and something you need to do soon. Today, the SMP Foundation needs your financial support. Maintaining the staff that is focused every day on suicide prevention, education, and training takes money. And to reach our goal of building a safety net of 300,000 trained individuals in southeastern Virginia, we need even more trainers who can get us there. So please consider a gift, and especially consider starting a sustaining monthly gift, joining us for the long haul. $10, $20, $50, $100 each month will add up to significant support over the years. We need you to make suicide prevention one of your causes. Maybe it hasn't been because you haven't thought about it. And yes, it is a relatively new cause, but we need people like you to make it one of your causes. And then tell your friends and neighbors why it needs to be one of their causes too. And the thing you need to do soon? Become part of the safety net we are building. Get trained in suicide prevention. Go to the SMP Foundation website, www.worldwithoutsuicide.org, and find out how you and your friends and the groups you belong to can get trained in suicide prevention. Do it soon. Don't put yourself in the position of connecting dots after it is too late. Thank you so much for your time, and I hope you will join our cause.